the value that Ponea brings to the table is around simplifying, okay? I would call two things. We enable providers become successful by providing them what we call customer interface platforms, okay, that they use to be able to bring value or bring customers to them. You build a hospital, then I think everybody says, okay, patients are gonna come to me. That's how in emerging markets, you sort of build healthcare. Let me build, they'll come to me. I think that has changed. Customers are saying, look, we are fed up with this. We want service delivered to us. Number two, we want when we go to a hospital, we have to be treated like we go to a hotel. So I don't see the difference between you going to a 3-star hotel, they still make an effort to treat you well. Even a 2-star hotel, they still make an effort to treat you well. Even a 1-star hotel, that guy will tell you, my friend, this is done, this is, so there is always value in the hospitality business. Healthcare can also be looked at as a hospitality business. So patients are fed up by saying, look, just because you build a hospital doesn't mean that I cannot get premium service. But premium service does not mean I have to overpay for it. Okay, because the cost of medical delivery does not necessarily mean it resonates to the quality of service delivery in terms of medical outcomes. So today, what we've sort of done, we've sort of brought some level of transparency in all our service providers in terms of you don't have to be massive. It doesn't mean because you charge $10 for a service, somebody else charges $25, that the $10 service is inferior to the $25 service. The $25 service could be complemented by a medical operator who has then maybe built infrastructure, whether it's parking or internet hotspots, whatever. But maybe I don't want that stuff. I just want to pay $10. I don't care about parking. I don't care about other stuff. I just want good healthcare. The outcome has to be the same as that of where I could get parking. But there's another guy who is willing to pay even $45 not to have a queue to get a medical test of malaria. I'm in a hurry. I want to do this. I don't care. I want parking. I want to do whatever. I want to pay for that. So it's the issue like we're all going to London. We bought a flight from Dubai. Some people are going to be in first class. Some people are going to be in economy. But we all land at the same time. Right? But the experiences are different based on where we land, but we land at the same time. So I think healthcare could also be looked at from that point of view. And that's what I think we've managed to execute. Now, today, if you could look at our marketplace, we're in a position where we are able to tell you, you as a customer can make the decision. You can make a decision based on price. You can make a decision based on quality levels of a provider, ISO certification, whatever certification you're looking at, you can make that decision. It is left up to you as a patient to make. Two, whatever interaction you have with a provider, that information remains with you as a patient. So it means when you go to the next provider, you don't have to again start from zero. You already have your information. So it means constantly information which is your own information, which is your customer information, which is your patient information, should always be available for you when you're going to the next interaction with your provider, which could be the provider of choice that you want today. Maybe your provider of choice today is A. Maybe your provider of choice tomorrow is B. Maybe your provider of choice is C when your financial status is much more enhanced. So that today, as Ponea, our biggest competitive advantage is enabling all these providers have visibility on our platform, simplifying their customer interaction ecosystems, because we own that, or we try and bring that to them. And lastly, also giving the customer the owners of the control of deciding where they want to go based on price, based on the financing model they're going to be paying for, based on location, based on consult, based on home service. So the efficiency level that you want or the convenience level that you want as a patient is up to you.